Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have any questions or concerns or seeking advice, diagnosis, and or treatment, please seek individual, personalized advice from a healthcare provider in your area. We are not liable for any risks or issues associated with using or acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride. Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant.
Happy Cinco de Mayo.
It is. I did not have a Mexican meal today. Kielbasa and pierogies and sauerkraut.
That is the opposite. If there's an opposite of cultures, that is the opposite.
I think it is. I think I did that. It's what we had in the house to cook, and the kids will eat it. So.
Okay, that's fair. Yeah, I just had leftovers, but I went out to a Mexican restaurant over the weekend, and it was pretty good.
Okay. Last week, I actually went to a pharmaceutical dinner that was very casual, and it was at a Mexican place right near me. And that's where I was actually telling people about our last episode about the toad licking, and they were very, very intrigued.
Nice.
So hopefully they actually listen. I don't know. People like to chit-chat. Get out there and listen.
Well, it's funny. I was talking with a patient and their family member today about psychedelic advancements in treatment of autism. We're not there yet, but there's a lot of studies, and they were just fascinated, and they thought it was like the coolest thing ever.
Yeah, cool stuff happening.
Yeah.
Well, how was your weekend other than Mexican food?
I had to go shopping because I'm giving a presentation next week, so I needed sometimes I wear the same black pants, the same outfit every day, so I just needed a fresher pair of black pants, and
yeah.
I needed a blazer that fit more appropriately, and then I needed shoes because I wear flats to work all the time, and I feel like I should wear heels if I'm up in front of a crowd and presenting. So
getting fancified.
Yeah, I had to do all that stuff and then make sure I have everything for vacation week after next. So just kind of doing stuff like that. And I think I told you last time that my AC broke, so yes. I was also trying to avoid my house because it was very hot over the weekend.
No. It's still not fixed.
It's going to be replaced on Friday, so just a couple more days. Yeah.
Well, it's cold and rainy today, so we got that.
And it's supposed to be this way for the next few days, so hopefully I can just hang in there.
You got it.
Yeah.
You can make it.
It's not the dead of summer, so I'm lucky.
What are you presenting on? What topic?
I am presenting on, the official title is... Dun, 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 The Role of Rehabilitation Psychology in Brain Injury Recovering, Empowering Patients and Families.
Nice.
Yes.
Cool. This weekend, I ran around for children, and I've just I'm done. We had a state gymnastics meet on Saturday that was 2 hours away. And so, we didn't have to be there early, but by the time we finished, and then we ended up getting dinner, which was good before the drive home. I didn't get home till 9:30 at night. And then the next day I had a dance competition, got there a little before 9 and didn't get home from that until 9:30 at night. That was only a 45-minute drive, but still. So I know it sounds like it's not that exhausting just sitting and watching, but it kind of is. It's just a long day.
And then just being around all the kids and they're all hyped up, and it can be very overwhelming. So.
Yes. We made it to school and work today, but the little one who had the thing last night, normally she's in bed at 8:30. And then by the time we got home at 9:30 and had a snack and showered all the gel and makeup off, it was 10 o'clock this morning. We were literally I wasn't, but she was in tears. She was so tired that everything was just too much.
Yeah, I get it.
We all need a nap.
We do. I was meeting with a parent who had a little one, and we were talking about some of the problems, and she was like, he never sleeps. He never naps. He barely sleeps at night. And I was like, in 15 years, he's going to regret that.
Right? Yeah. Yeah. You need all you can get when you're little, because once you have responsibilities, it's not so easy.
Yeah. I would kill for nap time.
So today, I think I know what your topic is, but I think I forgot.
It's right there in the title.
It's the Huntington special. Is that today?
Yes. Okay. That is the name of my drink, is the Huntington special. This is, I think it's supposed to be in reference to the Huntington special firearm, but that's not what I'm talking about today. So,
well, plays on words. That's what we do.
Exactly. So Huntington Special it's actually a very small drink. So I topped mine off with club soda and ice, but I made my drink an hour ago. So now it's very watery. So I should have not put club soda.
That's because I got distracted by goodie bags for said child's birthday party this weekend, and I was like, I could bang these out in 5 minutes, and then it took me longer than that because I was being obsessive about making sure everybody got even amount of stickers that were Elphaba or Glinda, and that nobody was like not happy because it wasn't their favorite. So
Fair.
Sorry.
It's okay. So the Huntington Special Cocktail, it contains 1.5 ounces of gin, 1 teaspoon of grenadine syrup, and 1/2 ounce of lemon juice. Shake ingredients in a cocktail shaker with ice. Strain into an old-fashioned glass with ice. So when I strained this into my glass, it literally was not even a quarter of the way full. So I was like,
okay,
at the very least, I'm like, how is this going to get me through an entire recording? So that's why I put in some club soda, because I was like, I have work to do. I can't add more alcohol.
No, so a little sparkle. That's all.
Yeah. So today I am going to talk about an episode of a TV show called Something's Killing Me. Have you heard of this show before?
Is it like one of those things that like each episode does like some wacky, crazy like vignette of some illness like that a real person had?
So each episode is one individual case or one individual disease. And then they may talk about a bunch of different people who have it. So there is an episode of this series that talks about anti-MNDA receptor encephalitis, which we talked about. And it does have Susanna Cahalan on that. So that was pretty cool to see her again after we've spoken about that. But I'm going to be talking about season 1, episode 2, The Strange Case of Dr. Gilmer. So it's pretty cool the way they lay it out. And it is based on a book. The book is titled The Other Dr. Gilmer, 2 Men, a Murder, and an Unlikely Fight for Justice.
I feel like I had this book on a list of books I wanted to read.
Yes.
And I just didn't get to it yet. Now I got to put it back on my
You do.
I'm going to, I just signed up for Libby with the library, so I could probably put it there.
Yeah.
Nice.
So I actually haven't read the book. I want to, but the documentary follows the author of the book and the whole story. The book is written by Dr. Benjamin Gilmer, and he is a GP, general physician. And so he is looking to move, and he decides he wants to move to North Carolina. So in 2009, he was hired to take over a health clinic in North Carolina that Vince Gilmer had started. And his name is Benjamin Gilmer. No relation. They just happen to have the same last name. And so it was called the Cane Creek Health Clinic, I believe. It's in Cane Creek community in North Carolina. That's where it takes place. And so even though it's like a family practice, it seems like it's a lot of older folks are visiting this practice, have been there for many years. Now they have, some of them are in nursing homes, and so he's visiting them there, but it is a very small community. And basically everybody goes to this doctor. They've gone to this doctor for years. Their brother, sister, mother, cousin went to this doctor too. And so when Benjamin, and I'm going to call them by their first names, so not to confuse them, because they're both Dr. Gilmer.
Right.
So Benjamin, he gets hired for this job. He's like, this is great. This is that small town doctor vibe I wanted. This is amazing. And so he comes in, and he's a very sweet, personable guy. So you would think this is the perfect job for him. So he comes in, and a bunch of patients are afraid to see him. And he's kind of like, I don't get why people are scared to see me. They were coming to this practice. Is it me? What am I doing wrong? Is it because I'm, new to this community? They don't trust me. And then he starts asking around, and he comes to find out that the first Dr. Gilmer, Dr. Vince Gilmer, suddenly snapped out of nowhere and brutally killed his 60-year-old father one night. And that's why the practice was up for sale. Mm-hmm. So no one is really sure why this happened, but everybody's kind of shaken up by this sudden vicious murder that happened and all of the aftermath. There was a trial. He went to prison. So as Benjamin starts finding out about this, he's like, something doesn't add up. And he kind of goes on this deep dive true crime quest that we've all done when you've heard a case and you've Googled it and looked into it. And he's reading through this stuff, and he's like, it doesn't make sense. Something's wrong. So he goes down this rabbit hole of trying to figure out what happened. Why did Vince kill his father? And so eventually, I'm going to, jump ahead. He helps to get Vince pardoned by finding out that this murder was caused by a neurological disorder called Huntington's disease.
Got it. So unlike the sleepwalking guy.
Exactly.
So it's interesting, all these cases that could be tied back to other neurologic or psychiatric things.
Yeah.
Interesting.
So the background story is Dr. Vince Gilmer. He was a physician who worked in this practice that I was just talking about in North Carolina for most of his life. But his background is that he was born to a small family. His father was a Vietnam vet, and when he came back from Vietnam, had a lot of mental health, violence issues. And so those issues were then taken out on the family, including Vince when he was a child. So the father was physically abusive, apparently sexually abusive to Vince and his sister. His mother claims that she didn't know anything about this, but she admitted to being abused by her husband, by their father. So then, Vince is living in this really terrible childhood atmosphere, just trying to survive. And then he went to medical school, was doing well, and he married a classmate, his medical school sweetheart, and the two of them opened the Cane Creek Family Health Center in Fletcher, North Carolina. And he was described as, his nickname was Bear, because he gave everyone a big bear hug.
Aww.
So he really was a very loved person. So this brings us to, how would somebody so loved by the community, who seemingly, rose above his trauma and was successful, how did this happen? So what we know, the story gets a little disjointed, because by the time that Vince is in the court system, there's a lot of unusual behaviors that a lot of people are alleging that he's faking. So one of the examples is he's basically asking people for help, anyone who will listen to him, literally random people. He's telling them, there's something wrong with me, this is why I did this crime, you have to listen to me. And everybody's like, oh, he's, just like all the other criminals in prison, they're saying they didn't do it, which I will say, having worked in the prison system, everybody at some point will say that they didn't do it. Even if they do later, fully confess and, atone for their problems and serve their time, at some point or another, everybody's said, oh, I didn't do it. So I think that's something that they chalk up a lot to him saying, well, he was essentially saying well, I did it, but I didn't mean to. It wasn't me. I didn't know what I was doing. And it didn't make sense. And there's this one part in the documentary where they have prison yard footage, and they say that he's doing fine. And then all of a sudden, when he realizes that guards are watching him, he starts shuffling and mumbling to himself and acting strangely. And they're like, see, he was just fine 2 seconds ago. And you do see on the video, there is a distinct shift in his behavior, but it does seemingly come out of nowhere. And it doesn't seem like he's necessarily faking it in that context, because he's in the prison yard kind of keeping to himself. It's not like he was talking with someone and then changed his behavior. He was literally just kind of walking around the prison yard, getting some air. And then all of a sudden he's kind of dragging one foot, shuffling a little, mumbling to himself, shaking a little, but not fully. So this whole time he's basically asking for help. Nobody's believing him. He gets sentenced to prison for the murder of his father. So the way that he tells it was, in June 2004, his father, who at this point was 60 years old, he'd been diagnosed with schizophrenia and dementia. And so he checked his father out of a hospital, a state mental health facility, and he said it was with the intent to have him put in private nursing care. Which, he's a physician. He had the money to do it. It sounds like, he did the appropriate process of checking his father out and trying to transfer care. And so he told everyone that, before he checks his dad into this nursing facility, they're going to go on one last canoeing trip, because they used to go canoeing all the time when he was younger. Well, all we know what happens next is they find his father's body on the side of the road. And he's been strangled to death. And then when they start trying to kind of track back of what happened, they found that Vince had left bloody rags and other evidence just sitting in his truck. He wasn't even hiding anything. It was just sitting there. And then 2 days after the fact, he reported his father missing and said that on the canoeing trip, his father had wandered off. But then there's another point where he says he doesn't really remember what happened. He remembers the idea of going on the camping trip or the canoeing trip, but he doesn't really remember what led up to that. So then when he went to trial, he did the move that lots of people like to do, and it's always bad news. Can you guess what he did? That is always bad news when you're on trial.
He testified?
No, he represented himself.
No.
That's even worse.
No. Yeah. No. So he fired all of his lawyers and he represented himself, and he said that his father had sexually abused him and his sister when they were children, and that the night of the murder, the night of this incident, the father had attempted to sexually assault him again, and it triggered him and he lashed out at him, and that was what happened. And then he also said he was withdrawing from an antidepressant drug, which caused the violent behavior and triggered his suicidal thoughts. So I believe in the documentary, they said it was Zoloft, which I don't believe that's actually a side effect of it. I could be wrong with the medication, but it's usually when you're taking the medication, you may have change in behavior, not when you stopped it.
So that was a little unusual. And then it wasn't like a very clear time frame about when he stopped the medication versus when he had these side effects. But either way, he was basically trying to blame his behavior on something medical. And so that kind of sparked Benjamin Gilmer's interest of saying like, well, this guy's a physician. He was very intelligent. Like he knows what he's talking about, even if he's kind of using this as a cover. Like, let's like go down this road and see like, what is he talking about? What is he trying to claim? So Benjamin starts to kind of investigate the murder and things that are going on while visiting Vince in jail. So he finds out about him. He goes to like see this guy. He's like, I gotta meet this guy for myself and figure out what's going on. And his behavior in prison is super erratic and like makes no sense. Like he'll be rambling or he won't be making any sense. So then Benjamin starts to think maybe something else medical is going on. And then we go back and we find out that Vince, the murderer, had a head injury in a car accident. And then immediately after that head injury, suddenly divorced his wife, began drinking out of nowhere, stopped taking his medication. So big, huge personality change after this car accident. So then he was like, well, maybe it's something to do with a brain injury. Maybe something happened in the car accident. He wasn't properly assessed. And that's what triggered all this unusual behavior because nothing had really happened until then. And that was just a couple of months before the murder. So it was pretty, the timeline was pretty short. And then Benjamin wrote a letter to Vince. And then when Vince wrote him a letter back, he said like the handwriting was really off. It didn't make any sense. Like the letter, was not coherent. And basically he was asking Benjamin for help. So Benjamin's like, okay, this is bizarre. Like, let's figure this out. At this point, some podcaster becomes involved, Sarah Koenig, and she's doing a podcast about this case because she too thought it was unusual.
I think I've heard of her too.
Yeah, her podcast is called This American Life. So she was just covering his story in one episode.
Story, yeah.
Because I guess each episode is a different story. So now Sarah and Benjamin are trying to figure out what's going on with Vince. So they're visiting him in prison. And when they go to see him, he said that he had heard voices on the day of the murder and that his brain was failing. And so again, there's just like something like if someone's psychotic, they wouldn't necessarily be able to describe the events in that way. Like it would be a different sort of presentation. So then Benjamin continues to look into the court transcripts, documents from the trial, everything like that. And so now Benjamin is convinced like something medical is going on. Maybe it's mental illness, maybe it's schizophrenia, something like that. But like this man who had a thriving career, he doesn't just change overnight for fun. Something triggered this, something caused this. And so then he asked a friend who was a psychiatrist to visit Vince in prison. And then that psychiatrist started to suspect Huntington's disease. And then later he was tested and diagnosed with Huntington's, which is genetic, and explained what his father's behavior was. So he didn't have schizophrenia and dementia. He had Huntington's that was misdiagnosed.
Right.
And then what I'm wondering too is they said that his father was a Vietnam vet and he came back and he was changed from the trauma. I'm wondering if he had that earlier onset of those symptoms and they just blamed it on the trauma of being in the war.
Wow.
Because we do know that Huntington's, usually it starts around your 40s, but it can begin to evidence symptoms sooner. And if we're looking at like the grand scheme of things, his father was 60 when he was murdered. So that's still relatively young.
Right. Right.
So it's possible that he could have started showing these symptoms in his 30s and nobody really caught it. So it seems like it was the combination of the irritable aggression, the psychosis from the Huntingtons, violent behavior, suicidal thoughts from antidepressant discontinuation syndrome, which they're saying he had. I'm still not sold on that one. And the history of the sexual abuse, kind of all of those things together are what triggered his behavior the night of the murder. So they bring all this evidence, they do an appeal, and he actually gets granted clemency so that he can get transferred to a mental health facility. And this all happened in 2022. As of 2023, Gilmer had not been transferred out of the prison yet. He'd been granted clemency, but they really just didn't have a place for him to go to. And at this point, he didn't really have a whole lot of family who were willing to take him in, take care of him. His sister, who had corroborated the abuse, she mysteriously disappeared, which is very bizarre. No one knows where she is. Nobody's heard from her. She's not stepping forward. So very unusual family presentation. My thought was maybe the sister has symptoms too and doesn't know it, or she's in a facility somewhere. So most people who are listening who don't know about this are probably like, what's Huntington's? Tell me what the heck this is.
Well, if they listened, we did bring this up twice.
About the chorea, when we talked about the chorea.
And we also talked about it on the house episode because the young one, what's her name? She's a number. What's her name?
13.
That sounds like she's a number. That she was possibly one of her parents had it. So yeah, we've had little spurts of it, but never really gotten into it.
Yeah. So there's a lot more to the case of the other Dr. Gilmer, that book. There will be a link to the Journal of American Academy of Psychiatry and Law's review of that book. So it kind of gives you a synopsis, how they feel about the book and how it's presented. But you can also buy it. $28 hardback, Ballantine Books, 2022.
Okay.
We do not get any sponsorships from them.
No.
So what is Huntington's? Huntington's disease is considered a rare but inherited condition of the brain and the nervous system, where the nerve cells and the neurons in the brain break down and die, resulting in uncontrolled physical movements, which is known as the Huntington's chorea, as we just talked about, or chorea, which is that unpredictable, quick, jerky movements that happen with that disorder. But there are also several other symptoms that happen with Huntington's, or HD. I'm going to just keep calling it that because it's a long mouthful of words to say. But with HD, you tend to have other symptoms. So can be hallucinations, mood swings, personality changes, irritability, depression, things that look like bipolar disorder, but also difficulty speaking, swallowing, and walking, muscle stiffness or rigidity. So that shuffling I was talking about before of him in the prison yard, problems with balance and posture, problems with memory, learning, focus, decision-making, and multitasking. So as I said before, it is genetic. It's a variant of the HTT gene that's passed down through families, and only one parent needs to carry that abnormal gene to pass it down to
right.
a
That's
child.
what's so scary, because it's a dominant gene, and you don't know you have the disease until after you've typically had children. That's
later,
the whole thing.
Later in life, yeah. And then that's the thing, like we were just talking about in this case, is that more than likely, if they had known to look for it in his father, they would have been kind of putting the pieces together with his symptoms as well. And then we also don't know how far back this was noticed. We don't know about his father's father and his life and what went on, in his experience. I don't know for sure that it's passed down necessarily on the male gene, because only one parent has to have it. But I'm assuming if his father...
It's not an X or Y mediated. It's just a gene you wouldn't pass on, but the thing is it's dominant. So like you said, you only need one copy. So you only need one parent to have it. So it's like 50-50.
Yeah, it's a 50% shot. So it's a big gamble, especially, not everyone who has HD is going to end up murdering someone. That's what made this case so unusual, because we do find that more than likely was what precipitated that event. But a lot of these other things, it could have been why he had that car accident. Maybe he lost motor control.
Right.
It could have been why he suddenly divorced his wife when everything seemed happy, because he's now not making clear decisions. So it adds up for a lot of the problems we saw prior to the murder.
Right. I mean, I'm familiar with more the neurologic physical symptoms, but I really did not know the extent of the other psychologic type symptoms that you could have. I knew about the physical and that's progressive, and eventually walking and eating and swallowing and all that become an issue, but I really didn't know that it could present that way, which is pretty interesting, because there's a lot of patients that could possibly be.
Yeah. And so I think part of it is because those neurons are dying, that's what's leading to some of this unpredictable or inconsistent behavior, because it depends on what neurons are dying where and how many of them. And so it's a lot of stuff that's happening all at once. And so it's not first you have this symptom, then you have this symptom, then you have this symptom. It's a cluster of symptoms that can occur and change over time. So as I was saying before, most people start to develop the symptoms between their 30s and their 50s, and the condition gradually worsens across about 10 to 25 years until the person eventually does die from this disorder. So some of the early behavioral changes that we're going to see in Huntington's are reduced emotions, lack of emotions, or not recognizing the needs of others, so that empathy starts to kind of be lost. And I think that is something that, especially if you're thinking somebody's getting older, they're male, they have a stressful job, you might just be like, oh, they're burned out. Especially like being a physician in the small town, the only physician. If he's then starting to be crabby or not as emotionally in tune with his patients, you can say, oh, well, he's just working too hard. He's he's overextending himself. But there can also be periods of aggression, excitement, depression, antisocial behavior, anger, apathy, changes in hygiene and self-care are a big warning sign for that. Difficulty concentrating on one task and handling complex situations. So how good of a physician was he prior to all this? I have to wonder if he was still giving a high quality of care to these patients, if he's starting to suffer in this way.
Right.
And then irritability and impulsiveness. Then later on, those symptoms become much more clearly psychiatric. So some people develop like obsessive compulsive type behaviors, delusions, stubbornness, lack of self-awareness, suicidal thoughts, and then more of those neurological symptoms that you were talking about, the uncontrollable face movements, jerking, clicking, fidgety movements of the limbs and body, difficulty eating because the mouth and throat muscles no longer work as intended, choking, chest infections, all because of the muscular breakdown breakdown or the loss of muscular control in those areas. Communication problems, slurring of speech, sexual problems. So this is interesting. A loss of interest in sex or making inappropriate sexual demands. And so we see those changes in sexual behavior in other sorts of brain injury. So frontal lobe brain injury can cause increased sex drive, increased sexual activity. And so it's another neurological thing. And then the balance problems. And eventually in the later stages of Huntington's, the person will need full nursing care because they can no longer care for themselves. And death is usually from a secondary cause like infection or pneumonia. There is such a thing as juvenile Huntington's disease, and that's it is also genetic, but this presentation of it is much more rare, and it typically begins to show signs and symptoms before the age of 20. So that's quite young. And then you would tend to see a rapid decline in school performance, changes in handwriting because of the motor movements, problems with movement that look like features similar to Parkinson's disease, and seizures. So like we talked before, there's that genetic component, how it's kind of a 50-50 shot if it's in your family. But in about 3% of cases, there's no obvious family history of the condition. So this, like I said, someone could have died before they were diagnosed. It could have been misdiagnosed as something else. Or there's a very, very rare chance that it's a new fault in the gene that is causing this 3% of cases.
Wow.
So kind of mutations of the genes that we know happen over
Right.
time. So diagnosis is typically done through brain injury, imaging, neuropsychological testing, ruling out other conditions, things like that. So you would need to see a neurologist or a specialist in order to have it diagnosed. And then treatment, kind of like we said, it's a lot of palliative care, unfortunately, because there is some of the treatment might reduce the evidence of some of the symptoms, but it's not slowing the progress of the disorder. It's going to, once it starts, it's kind of a slow and steady decline, unfortunately. And if you think about it, if you're diagnosed and they tell you you have to live like that for 25 years, there's a very high suicide rate in folks with Huntington's because of that. And then especially because of that guilt, finding out that you're diagnosed and then thinking, oh, I've got 3 kids. And what if I gave it to my kids? And so there's a lot of guilt and shame and just wanting to not have to suffer in the decline that happens over the years afterwards. So that is, I'm making sure I got all my notes.
So, I mean, I think a lot of this, though, is also then, okay, so your parent has it. So then there's a lot of, like we saw in House, questioning, well, do I get tested?
Mm-hmm.
What does that mean? So am I going to live my whole life knowing I'm going to end up this way? Or you could look at it the other way. There are new trials and things, and get into a trial because when you're at a younger age prior to symptoms and try and do it that way. But I'm sure that's very, very, very stressful.
Right. And I think it's just like how we've seen with women who have the BRCA gene, having that concern, people who have other genetic disorders. And that's really where genetic counseling comes in, where once it's identified in an older family member, getting those younger family members in and having those talks, making those health plans for their own lives. So that way, if they haven't had children now, they can make a more educated choice about that. And with certain disorders, especially with women, unfortunately, if you do have a known genetic disorder, they're not going to allow you to do things like egg retrieval or IVF. And so it does limit some of your options of producing, depending on what the genetic disorder is.
I mean, with this, I could say, like, you probably wouldn't have symptoms till the child is, depending on what age, I guess you do it until the child is already an adult and self-sufficient. If you did IVF with the genetic testing prior to implantation, you could then weed out the other ones who have the gene and then only implant the ones who do. I mean, I guess it's probably on a clinic to clinic basis as far as the fertility clinic and what they would do with that. But I guess if you're 20 something and hopefully you won't have symptoms till 40 something, maybe then you can get this person to adulthood. But then what's the guilt of, well, then now I'm leaving them.
Right. And like I said, if someone's able to conceive naturally, maybe it may not come up as often. But if you're going through that process, you might hit some roadblocks. Like certain clinics may not be willing to help you with that, knowing that that child is now going to carry on and possibly pass on again this gene that could cause problems for people. Yeah.
It would just be IVF being the one way to select out, the gene. But there's still a whole lot of ethics involved in that.
Yeah. And it's a tough decision to make. And like you said, do you want to know? Do you not want to know? I think I'm the type of personality where I say this knowing that I don't, or believing that I don't have anything like this in my family, but I'm the type of person who I would like to know so I can make an educated choice. I may choose, it is what it is. I'm going to still live my life, with no boundaries, but then other people may live differently. So it's kind of, how do you feel like you're prepared for that? And I don't know if you're ever necessarily prepared for the full answer to it, but it can be very complicating. especially if now you're in that sandwich generation where you have to take care of the older folks who have this disorder until they pass. And then you've got young kids of your own who now you're worried about having passed it on to them, plus your own health issues. So there's a lot to consider when we're talking about a genetic disorder of this particular type. So that's what I've got for HD, Huntington's disease.
Yeah, no, it's funny is I run across books and things and I know like little bits and pieces and I totally had that on a list somewhere that I wanted to read it. So now I got to go look it up. Yeah, that's an interesting one for sure. And I think for what I've heard, I don't know about the documentary, obviously, since you watched it, but the book I heard was well done. So hopefully, I'll read it and we'll see.
And it was just one episode of this documentary series. So of course they condense in a lot. The Dr. Benjamin Gilmer, he's just this wonderful man. He's not related to this guy at all. And he's
so funny,
setting aside his life to essentially try to save this man just because they share the same last name. And he even says it at one point. He's like, if we didn't have the same last name, maybe I wouldn't have even cared as much. But like when somebody says, oh, Dr. Gilmer's in prison, he's like, I think of myself. And I'm like, somebody help me.
Right.
And then, like I said, he was granted clemency in 2022, but as of 2023, he'd not yet been released. And I don't know the details of it, but what I would imagine is if they want to transfer him to a psychiatric facility, that is very dependent on the number of beds, the number of patients. And then with Huntington's, because it is a disorder where you are going to eventually die from, they may not be willing to take him and have him in a bed unless it's court ordered, which it sounds like the court is kind of like, we don't want to get involved anymore.
That's the other thing. Okay, so having worked in both inpatient psychiatric care and in subacute rehab and then long-term care for nursing homes, in order to be at least, I believe it's Medicare guidelines, I know for sure it's New Jersey guidelines, into a nursing home facility, that's where you need assistance with your activities of daily living, your primary diagnosis should not be a psychiatric diagnosis, for example, or a developmental diagnosis. So, for example, someone with schizophrenia who can't take care of themselves because of their schizophrenia, but is physically capable, cannot go into a regular traditional nursing home. Or a patient with Down syndrome who maybe needs assistance, but medically is pretty stable, again, because it's a disability like that.
And that's really where we need to work on changing the system, because people with Downs, people with autism, people with schizophrenia who need that more intensive support, they're living longer because our healthcare system is better, but we have nowhere for them to go.
So I have seen eventually a patient with Downs end up in the nursing home because then their physical issue required more. But it's a game, because then the psychiatric facilities do not want anything
physically.
They're too complicated medically or need more assistance with ADLs. They don't want them. So there's this in-between period where you're like, well, nobody wants them.
Right. And then that can cause problems. I actually had a patient who was diagnosed with schizophrenia. He allegedly had a brain disorder, a brain injury, which we then eventually found out he actually didn't have. And so they wouldn't keep him inpatient, psychiatrically hospitalized, even though he was having active, violent, aggressive behavior, hallucinations, delusions. So they wouldn't keep him there. But then the inpatient brain injury rehab wouldn't take him there because of the psychosis. And then so he ended up in our residential program, which was not appropriate for him because he was too psychotic to be able to take part in the programming that we had and, care for himself and a lot of those rehab goals. And eventually, unfortunately, he, I don't want to go too much into this person's history, but he did something that put several lives at stake, including his own, and then was involuntarily hospitalized. And we were able to discharge him from our program. But the problem was then the family was refusing to take him. Nursing homes wouldn't take him. Inpatient wouldn't take him. So he was kind of in limbo. And then you feel bad for this person. He just needs somebody to take care of him, and nobody would.
Right.
And I don't think cases like that are as rare as we would like them to be.
Oh, no. They're very common. Absolutely. All right. So I have a little bit of a different turn, but interesting as well. And there's definitely some points in this where I'll need your input.
Okay.
So
I know which points already. I saw some familiar titles on there.
My drink is called The Hard Knock Life, inspired by Annie.
Who is not at all related to the rest of what you're going to talk about.
No, it is not Annie, the show or the movie. I mean, the movie or the Broadway play or any of that. But it does cover an orphan, so we'll say that.
Wait, we're not talking about Jay-Z's Hard Knock Life?
No, not that one either. Oh, that's pretty good. So my drink actually came from like a Broadway themed website, which you'll see linked, which is kind of funny. So the Hard Knock Life, you use a highball glass filled with ice, and you add 3 ounces of lemon lime soda, 1.5 ounces of cranberry juice, 1.5 ounces of ginger syrup, and then a shot of brandy. So interestingly enough, I always have these stories about how I kind of rig my cocktails slightly. So I didn't have any like Sprite in the house. And I was like, I'm not going to run out for, it's like a rainy day. I'm not running out for Sprite. But I did have like lemon seltzer or lime seltzer, and I can make simple syrup. And what is Sprite but sugar and bubbles?
Yeah, you're right.
In a lemon or lime. So that's what I used. It was pretty good. The drink's pretty tasty. The other thing is, I actually think if you have ginger beer, if you just take out the ginger syrup and the lemon lime soda, you could probably use that in this drink and it would work equally well. The other thing I learned, that all cognac is brandy, but not all brandy is cognac.
Oh, just like whiskey and bourbon.
Or like champagne and sparkling wine.
I was going to say champagne comes from a specific region.
That's the same thing with cognac. It comes from the cognac region. So I think it's Cavassier, which is cognac, which is technically a type of brandy, but that's the special one that's made in the cognac region. So anyway, there's a little liquor history there because I had to learn it myself to make sure what I had in my cabinet was good.
And my question is, where'd you get Cavassier from? That does not seem like something you would drink.
No,
must have been a gift.
I have like random bottles and I'm like, I have like, they've probably been there for 10 years, but I'm like, liquor doesn't go bad, so we're good.
Just lose the strength. So.
You know, I'm sure it's good. All right. So the show I'm covering, or the shows, or the topic, it's kind of a lot of things. So The Curious Case of Natalia Grace is a documentary that actually ended up with 3 different parts.
Yes.
So the first was titled,
watched all of them multiple times.
Yep, me too. The Curious Case of Natalia Grace is the 2023, the original.
I'm sorry, I have to interject. Did you know, because you probably saw it as you were finding it, because of The Curious Case of Natalia Grace, now they have their whole own spin-off of The Curious Case of blank, and then they talk about other bizarre things.
No, I didn't notice that.
It's crazy, because there's some episodes of that I might want to cover.
Oh, we're going to have to. So then the season 2 was in 2024 was Natalia Speaks. And I'll talk about how each of these are sort of framed. And then the final one was called The Final Chapter in 2025. And then there's also this absolutely really, really bad dramatization.
Thank you for saying that, because I watched one episode and I was like, WTF.
I made it through 6.
Although the guy that plays the dad
is like spot on.
Voice and everything.
Yeah.
Perfection.
Spot on. So Good American Family is the dramatization with Ellen Pompeo. I looked the guy up. I don't know his name off the top of my head. And I did look up that the person who plays Natalia Grace is actually a person with dwarfism, a just different type, and that she's 29. I really thought it was a child playing that role, and I just didn't get it. And I was like, I feel like they need her more
British, either British or Australian, because I saw an interview with her, and she was an actress, and she saw like the casting call for it. She's like, they're never going to hire me. I'm not even from the US. And then like she got the call back, and she's like, this is amazing.
I mean, I'm sure like what she's performing, like she's doing a good job. I just feel like the whole thing was just framed very bizarrely. Like just, I don't know.
Absolutely. Very dark
weird
sets.
It's just, the whole thing was just bizarro and hard to watch.
I mean, the story was bizarro and hard to watch.
True. But I was invested.
I never, so unpopular opinion, never really enjoyed Grey's. So I already had feelings about Ellen Pompeo, and this did not improve my feelings about her.
Well, her character's supposed to be unlikable, so it just makes it all so bad. I never liked her
before anyway, so now I even hate her more. Although I did go back and start rewatching Grey's, and I'm gaining some appreciation for it. Just not her. Not Meredith.
All right, so let's talk a little bit about the story and who Natalia Grace is, the kind of subject of all this. Natalia Grace was born, well, this is debated, but I think we have a final answer. Born in...
Starting messy from the start.
Right, 2003 in the Ukraine. And she was, the way this documentary follows, it is only from her adoptive father's standpoint and one of her adoptive brothers. The adoptive mother is not part of the documentary. And the first season of the documentary, Natalia herself is not even speaking in. Mm-hmm. So that's how they sort of frame it and sort of build this sort of mystery up.
Which I feel like that was purposeful, not having Natalia in the first season.
Yes,
because she was clearly on board.
For sure. I feel like the whole thing was framed to make you think one thing and then think another thing. But I think in the end, I think I have a solid decision.
I will talk about it.
Okay. So
also, I'm sorry, can I just say, because I clicked on your wiki link, formerly known as Natalia Lourdes Ciccone, is she Madonna's daughter?
what?
Because Madonna's daughter, I believe, is Lourdes Natalia Ciccone.
That's
I
weird.
believe it's the two names are reversed. Yeah.
Yeah, somebody messed up on the wiki. Nobody's checking.
Although I feel like Ciccone was the first adoptive family, which you'll get into.
That's what it is. Yes. You are correct. And maybe they threw her a middle name that went more with her culture. That's what it is. That's why I was like, wait, yeah. So yes, originally she was born in the Ukraine in 2003, and then she was adopted by her first American family in 2008, the Ciccone family. They are not featured in the documentary, but they're spoken of on and off throughout, but it still kind of leaves what happened in the 2 years between when they adopted her and then when she ended up going to the next family, the Barnetts.
I know, and I so want to know about them. I so want to know.
She was 5 when she was adopted, and then 7 when she was readopted. So she should have some memory of that time, but who knows with everything that's gone on in her life.
Well, and you're probably going to get into this, but I feel like I need to interject here because a lot of the drama that came up when the documentary came out was about rehoming or returning an adopted child. And people were talking about this like it was the most bizarre thing and how can you do that? And having worked when I began my career directly with the state of New Jersey Child and Family Services, rehoming happens often. I'd say maybe 25% of the cases. It's a high rate. That's probably not the exact number now, but it is a very high rate of children that are rehomed. So this is not as bizarre as people made it out to be. And it's not as uncommon as people made it out to be.
Right. I think
there's a whole documentary about that. It's a different family who had to rehome their child.
I think, her having a disability and then all the other sort of drama and court case and things is probably why this one became such a big thing.
Yeah. The documentary, sorry, I just want to, in case listeners are like, what documentary is that? It's called An Update on Our Family, and it was about a family vlogger who rehomed their child.
I do know who that one is. Yes. Yeah. I feel like I've watched some of these things and then forgotten that I watched them. Yes.
Which that child did have physical disabilities and mental health problems and things like that. So it wasn't like they were just like, we don't like you anymore.
I do remember that one. So yeah, Natalia was born in the Ukraine. She was adopted in 2008 by the first American family. And then where we pick up is basically her adoptive father from the second family, from the Barnetts. And he's telling sort of the story along with they do have pictures and videos of her as a child as well, kind of interspersed throughout this.
Well, and I do have to say, if anyone is living under a rock, I think 95% of why this case got popular was because Michael is so damn dramatic.
Oh my goodness. He's like something special. He is something special.
He's another level of drama. And
yes,
I think that was why reality TV was like, we love you.
We love you. Yeah.
Because honestly, when you talk with Natalia and she's not upset, she's pretty low key, like not that interesting as you would think.
Right.
But Michael is so
he brings
the
drama. He brings it. So she's adopted by this family. So the Barnetts, they're this sort of quintessential, or as you see, at least on the surface, perfect family. They have 3 boys. Their oldest boy has autism, but it seems to be like a savant in math or something. The wife is very into opening this daycare for children with special needs, and she's trying to write a book, and she's trying to sort of use, I guess, her experience to get out there for other families. It seems at first like the husband was fairly successful and then lost his job. So, of course, there's a lot of drama between the two of them. But at some point, they decided they wanted to complete their family by adopting a child. And they were specifically very open to a child with special needs because they wanted to highlight what they had done, I guess, for their oldest son with autism, I guess is the way it was framed. So it was sort of backdoor that they got this adoption. Like they were hooked up with an agency and there was nothing. And then all of a sudden it was like, come here right now, pick this child up.
And that's a whole nother thing that they don't really talk too much about in the documentary, and I don't think they talk about it at all in this show, but there is a very large market for these underground adoptions of kids from other countries.
Yes. International adoptions in general is a whole messy area. So they go was it Florida or one of the Carolinas?
Florida.
Florida, yeah.
Because that Florida agency is like, no, we have nothing to do with you people. Go away.
Yes, they like closed their doors after
It's
something.
probably the only good decision Florida has made in a while. They were like, nope, not touching that one.
So supposedly they met this little girl. She has a type of dwarfism called spondyloepiphyseal dysplasia congenita. We'll get into other types of dwarfism, and they take her home. And, you know, I guess they frame it at first the way Michael tells it, and then the way the movie or the dramatization shows it, and the way I think the story is retold later. There's a lot of inconsistencies, but he says that they're still in Florida, and the mother goes to give her a bath in the hotel room before they're heading back, and that the mother flips out because the child has pubic hair. And she's supposedly 7 years old. And right then and there, you know, they're shocked by that.
Which I see that you have it in your notes, so I'm not going to go there. But, like, that is not necessarily unusual.
Right. Exactly.
Like, that was the kickoff to this whole drama. And it's like, if you did your research or just Googled it,
right,
it's not that unusual.
Right. So supposedly they take her home, and I assume things started out okay. You know, what's interesting is you hear all these reports from them, but they never say like the school called. I don't believe she was in school consistently. Okay. Because I would think like if she had such significant issues, which we'll get into their accusations, that there would also be these behaviors in school.
I don't think she was in school consistently. And then I remember at some point during the documentary, them talking about how the mother had homeschooled the other children.
Right.
So maybe she was
homeschooling her.
I'm not going to go there.
I know. There's so much to unpack in this, and then we have to get through it, and I'm trying to be like organized, but there's just so much.
I'm sorry. And I keep jumping in because there's so many psychological things.
I know, and I like that you know the story, so it makes it more interesting.
Girl, I know everything. I know Natalia Grace's, how her accent changed when she was with different families. Don't get me started.
So, you know, basically they say that during the time that she was with them, that she had several behavioral issues. These are their claims told by Michael, the father. Again, the mother is no longer in this.
Well, and I don't think she was necessarily refuting his telling of Natalia's behavior. I think she was refuting her behavior.
Right. So a couple of different things that come up throughout. One of the things that they said is that she put some sort of a cleaning solvent in the mother Christine's coffee. Another accusation is that she would try to throw toys into the street so that her brothers would run into the street. Another one that she would defecate or urinate in the car on purpose to upset the boys.
Also something that's not so unusual, unfortunately.
Right. In children with trauma, yeah.
Exactly.
Another...
Or, given her disorder, maybe she has difficulty knowing physically when she has to use the bathroom.
Right. There's a whole lot that could, that can explain a lot of this. There's a whole story which is told a couple different ways about them going to some farm and her pushing her...
Yes, with the electrical fence.
Her adult, average size adoptive mother into an electric fence.
Is like 5'6", and Natalia's what, like 3'2"?
Yeah. Into an electric fence for cows or something. And one of the other accusations they make is that they found a bunch of socks in her closet that had blood on them, and that led them to make these statements that she is not the 7-year-old that she claims to be, and that she is actually an adult or an older child masquerading as a child.
Well, and I forgot about the socks because they were assuming it was period blood, but they had said multiple times how bad her feet were and how many surgeries she needed. I'm like, maybe her feet were just bleeding.
So in the dramatization, they never said this in the documentary, so I don't know where they got this info and how accurate the dramatization is. Mm-hmm. But they did explain it as that she took her bloody socks off her feet and hid them in her closet.
I was just thinking that just like having seen her physically in the documentary, the way that she walks, I can imagine that like when anyone walks and they stub their toe, they may bleed. So if she's walking and constantly kind of dragging her feet or scraping them or having trouble stumbling, her feet could bleed easily.
Right. So yeah, part of her type of dwarfism, often they have club feet or need different surgeries, special shoes. She did have one surgery under their care. Mm-hmm. And, you know, when you have something like this, you're constantly could be getting wounds on your feet. So absolutely. And it's interesting that the dramatization explained it, but the documentary didn't, because they were framing it very much ramped up that you're believing everything that Michael says in the beginning. And Michael in the beginning is passionate about what he's saying, but he's
not as
wearing
dramatic.
He's wearing a tie and he's very like personable about the way he's saying it. And
he's not screaming and beating the floor.
Right. In the first one, like he seems to make sense. But then he does start to talk about his wife's abuse of this child as well. And he talks about how he made her stand for an entire day with her head on the wall, literally leaning up against the wall, not able to move. And, you know, other just things. He did say that he witnessed her physically beating Natalia, and also that there's one of their sons was instructed to go and urinate in Natalia's bed because of her bad behavior or something along those lines.
And I believe this is because I think 2 of their sons have autism. It was one of the sons who has autism, and he was really traumatized by that.
Right. So the one son, the oldest one, who's kind of is the only one who now has a relationship with his father, and we'll get a little into that, but he's the one who is featured in the documentary and speaks, and he's an adult.
And I think I think that's why, because he's the only one who's of adult age. I think the others are still quite young.
Right. So all of these accusations and all of this sort of culminates into them deciding to try and get a lawyer and try and have her declared older than she actually is. And they basically only use the written records or testimony of a primary care general practitioner, family practice doc who sees adults and kids, not a pediatrician, not a specialist in dwarfism, not an orthopedic, not an endocrinologist.
Not a neurodevelopmental pediatrician.
Right. Nothing.
There's so many options.
Just some random guy who sees everything from your big toe hurting to, you know, an earache to whatever. I don't know. What would judge? I don't know.
I don't remember if it was in the movie or in the documentary, but that doctor said, well, this is what they told me. So I just wrote down what they told me. And he apparently didn't even examine Natalia. Yeah.
So in 2012, they were able to successfully change her legal birth year from 2003 to 1989.
While she was inpatient psychiatrically hospitalized, so she was not part of the whole
I forgot about that part. Yes,
she was not part of that whole...
I forgot. Let's really quick dive into the psychiatric stay. So they had all these, how they had people testifying who worked there first. I mean, not on the documentary, who worked there about her. Did you hear
former employees?
It's still freaking HIPAA.
Oh, no, you're right. But I'm saying that's probably how they got away with it. They don't work there anymore.
They said that because of finding out that she was acting older or looked older, they moved her from a pediatric unit because she had breasts and menstruated to an adult unit. Well, guess what?
Which is the other thing.
Guess what? 9-year-olds menstruate. 10-year-olds menstruate. It can happen. Do you move them to an adult unit?
But I'm going somewhere else. Most units in most states, they're pediatric or adult, have males and females separated. Mm-hmm. So this unit didn't have a separation of male and female. So then when they're saying that she was flirting with the men, maybe she was asking them for things because nobody was giving her crap. And then they're like, oh, she's flirting with them to get what she wants.
Right. So actually on the inpatient units I worked in for psych, they were not separated.
But those are short-term units. They need this out to be a long-term unit.
Right. These were acute units.
Yeah. Long-term units, there's usually at least a separation by wing. So males on the left, females on the right.
Right. So yeah, I forgot about getting into that. Yeah, they did get her an inpatient psychiatric unit. So
and that was after the electric fence.
The electric fence thing.
Which again, no one witnessed.
Right. Of course not. So Natalia was then moved by the Barnetts into an apartment on her own. The first apartment at least seemed that it was accessible because it was like a first floor unit. There were other people around. It wasn't in a bad area. And they have all these neighbors talking about how she just walked up and talked to everybody and just walked in people's houses. Well, how old is she?
She's a child.
Point? She was born in 2003. This happened in 2012. So she's 9. Mm-hmm. She's a 9-year-old child living on her own. I know plenty of kids, especially kids who maybe didn't have a traditional upbringing or looking for attention, who would just walk in.
But let's also put it in context. She's a 9-year-old child who's only lived in the U.S. for 6 years.
Right.
So
Right.
some of those early social things, she's still learning. And when did she have the opportunity to learn those things? When she was inpatient? When she was getting shuffled around from foster home to foster home? Like some of these things that everybody's like, well, kids shouldn't do that. Did she ever get the opportunity to learn those
Right.
things?
Exactly.
And I should also say, I'm not fully convinced that she was a child, but I'm still like looking in the mindset of if she is, why are we expecting these things of her that are adult expectations?
Right. So, it was interesting. A couple of people, they played with the children or she just befriended them or, they saw her around, her dragging the garbage can down, her whatever. So they even flashed back to some videos of her playing with one of the neighbor's children. She looks very childlike. She's playing on a bike. She's very animated.
But then they said that she was humping the car sexually, but then like when you show the video, it's like she can't move her legs, so she's like scooting along and it looks like she's humping the car, but she's not.
Yeah, there's just, I think everybody's like, oh, yeah, I'll be in that documentary. What do you want me to say? They're like, yeah, me too. Like everybody wanted to have their little opinion about it. And so I can't recall what made them move her. CPS, someone called CPS on them. And so they decided to move her from one apartment to a completely different town, like not even remotely close.
And then they decided to move to Canada.
Right. So they were picking up and moving to Canada to go to the special school for their oldest son. And they moved her into this like 2-family home with a huge flight of stairs, with stairs even on the outside going up to even get to the house. And there was nothing accessible, nothing she could reach in the place. They set her up to get her GED locally down the street.
And that was their downfall. Because that's how everything went to shit when the people at the GED place were like, something ain't adding up here.
Right. They gave her an EBT card to get her food stamp type benefits so she can have food. And she was expected to go and shop with this. Mm-hmm. With basically, again, a child, no instructions on how to live life.
And a disabled child. So that was the other thing. Like her hands are also disabled. So how was she going to carry groceries home?
Her hands were significantly disabled, right? Oh, and that was the other thing. I totally forgot. Let's go back, way back. Standing in their bedroom with a knife in the middle of the night or having knives
she can't grip
in her
a knife.
bed. Yeah. So anyway, that was one of their accusations when she was a child and living with them. So...
Although then at one point she said she did sleep with a knife under her pillow because she was afraid of the mom. So at some point she was able to at least carry a knife from one place to her bed.
Right. I'm sure she could carry a knife, but I'm sure she probably couldn't hurt many people with a knife. And even if she did, that's probably more a result of her traumas than...
Right.
Anyway. So yes, people became suspicious, thought it was very odd. And so the issue was because she was legally declared an adult, it was a little bit tricky. There was a investigator involved. I can't remember his name, but he was that one investigator who kind of really did want to find out, get to the bottom of things. And he really felt like he was more on Natalia's side than most people. And, he was trying to get to the bottom of what was going on. But now that it was very tricky because she's already been declared an adult by this. But there is a statute that you can't abandoned a disabled child even if they are an adult. Like there was some other thing, and that's where he kind of found a space to try and go after them, to see what's going on and have somebody take responsibility and to hopefully help this girl. But in the meantime, she meets a friend. What's her first name? Cynthia Mann?
Yes.
Yes.
Her future adoptive mom, yes.
So I have to tell you, she's played very well in the dramatization. You didn't make it that far.
I gave up after the second episode.
She is actually plays the character very well. So that was a good casting as well. And the actress was pretty good for that. So even though in whole the show wasn't good, the actors themselves did a good job. It was just a bizarre show. So Cynthia, and I'm remembering because I watched the show more recently than the documentary, but essentially she sees her struggling out there and stops. Can I help you?
And they met in church or outside of church, right?
I know
did the church stuff come later?
I think the church comes later. I'm remembering it, like I said, more from the dramatization, but the way they had it there was that you saw her struggling, walking down the street, trying to carry groceries, trying to do all these things. And then she offered to help her and essentially sort of took her under her wing. She did, and this is shown in both the dramatization and in the documentary, take her shopping to use her food stamps card. And they insinuated in both ways that she also used it for food for herself and for her family. Mm-hmm. Apparently she has a lot of children.
Yes, and I think half of them are foster.
Right. They do touch on that a little in the dramatization as well, like that and so she gets different benefits from having them and different amounts of money for food, but she has a house full.
And I will say, from the documentary, it seems like she just genuinely is one of those people who wants to take in these foster children and take care of them. Like, I don't think she's taking in all these children to use them for their benefits, but she's definitely using the benefits.
Right. I agree. I think that there's no person who would just randomly have that many people in their life and in their house and that much laundry and food to cook and all of that just because they wanted the money, because then you would just take the money and not fold their clothes and
unfortunately
clean their house.
A lot of people do, but she's not one of them. Like, she's caring for these children.
Right. I didn't feel, that she was 100% taking advantage. I think there's a tiny bit of advantage being taken, but I think she gave more than she took.
I felt like she was taking more advantage that this was now a news story. I felt like she was taking advantage of that angle of it.
Right. So she ended up being essentially taken in by this family, while she was still supposedly living in the apartment. The apartment sort of sat there empty. And her husband, Cynthia's husband, who also, is part of this, he's a pastor. He has his own church. And that kind of comes up later in like the third or the second one.
And the last one, because I think in the last one, it comes to that it's not an actual church.
Okay.
Yeah.
So basically the way the first documentary ends is that she's living with the Mans and that they're going after Michael and Christine legally, not her, but the law is going after Michael and Christine legally for abandoning her. And then in the second documentary, they feature her herself, but they also reveal a lot of things that they didn't in the first about clues to her age. Mm-hmm. So they did go back and they at first spoke to her biologic aunt in the Ukraine and eventually to her biologic mother, who absolutely said she was born in, what was the year she was supposed to be born? The original year?
2002?
3? Yeah, 2003.
Well, and then that mom story is like so tragic because it's the Ukraine, it's 2002 when it's kind of like a war-torn country, and essentially she was saying that she was forced to give up her child because the child had disabilities, and so just that beginning, taking Natalia and all this out of it is very traumatic.
And that's not uncommon in that place and time as well.
Right. But just thinking like Natalia didn't have a shot from the beginning.
Oh, no. Yeah. I mean, essentially, and then she was in an orphanage. She's born in 2003. She's not adopted the first time till 2008. So she's in an orphanage for probably, I don't know when she physically came to the U.S., but probably at least for her first 4 to 5 years.
And that was one of the things that continually came up in the documentary that I was confused about as well, is that they said she didn't know a single word of Ukrainian. And I was like, I could see if she was adopted as a baby or as a very young child, but if you live there for 6 years and you don't know a single, like you can't say hello or goodbye,
that was weird.
Didn't make sense to me.
That was the one. That's literally the one thing.
And then she had completely fluent English, and I'm like, okay, so maybe the orphanage was bilingual, but you don't know any Ukrainian at all, nothing.
I mean, I could also say that maybe somehow with trauma, she didn't speak herself until she was older, but then you would still have understanding of it.
Exactly.
So, but we do verify that her birth mother, she was born. This is, we also find out that while she was with the Barnetts, she was taken to a specialist for dwarfism or different kinds of skeletal dysplasias. And she did have x-rays to look at her bones because she had to, but also those were used to determine a bone age. Mm-hmm. I had to, in the documentary, they did go and say, which I was happy, that it was a skeletal dysplasia specialist who said her bone age, because I'm sure with this disorder, the bones and the bone age and the growth plates are going to look a little bit differently than they would in an average sized child. So I'm glad it was not just a random doctor or a random radiologist, but an actual specialist in skeletal dysplasias who read it.
Well, and the other thing that I just thought of, which is probably beyond the scope of both what they talked about in the documentary, but also what we're talking about, I would imagine being shuffled around, maybe not always getting the best nutrition, that's going to impact your bone development / bone health,
Yes.
maybe
Bone health,
not your bone
right.
age, but it's going to impact
Right.
your bones in ways that may make it difficult to determine accurate bone age.
Right. So, this is a good point for me to just kind of do the little offshoot of bone age because it makes sense right here in the story. So bone age is essentially a set of x-rays that looks at your growth plates. And your growth plates, if you look at a child's x-rays, it's very interesting. When they're very, very little, their bones don't even look like they're in like the same vicinity as each other. And as they get older, they get closer, and then they sort of, these holes sort of close up. So at the bottom, like your long bones, you'll have this sort of straight line across where there's a separation, and that does close sometime after puberty typically. So this is used in other parts of medicine because usually we do know a child's age, but because of things like if you think they have a growth delay or they have precocious puberty, which we will touch on. So you're using that to determine their chronologic age versus their bone age, their body's age. And this doctor in this documentary basically said that it was concurrent. It did match what her age should be. And let me just give you the accuracy because I'm kind of all over the place.
I just thought about, and this is like just peripheral, so we don't have to go into it, but about that other family that they met, that the child had the same exact disorder, and how they were saying, well, they look so different developmentally, but because you have this disorder, you may not look identical.
Exactly. Right. So yeah, you compare hand and wrist x-rays. You could do long bones. There's a method that you can use to calculate their bone age. And there are things, like you said, genetic, environmental, and other things that can influence it. There are some variability. It's not a perfect science, but typically it is accurate. I'm
also wondering too, and this is just an assumption, I could be wrong. Hopefully this isn't coming across as classist or racist, but given what her mother was saying about her pregnancy, it doesn't sound like she necessarily got good prenatal care either. And that can impact all of this developmental stuff.
Yeah. I mean, at this point though, when we're looking at your 9 or 10 or 11 or 12, I think we're looking at, this is just a method. Yes, but this is a method to determine, have you hit puberty? Have you finished it or not? Kind of the end. But it is used often, like I said, in those other circumstances. And then the other modality that they used to help age her was dental age. She still had baby teeth. She went to a dentist when she was with the Barnetts. She still had plenty of baby teeth. You can actually see in pictures from when they had her, and she was missing teeth, just like any other kid would be at that age, which was appropriate. And so those can, again, they take a big, panoramic x-ray and they examine your mouth. And they're saying that it's typically accurate within like 3 months to a year and a half. So that's a pretty small margin of accuracy. So it's unlikely that she was, how many years did they move? They moved her like 14 years or something.
Well, and I remember something in the documentary. They're like, oh, well, we did this test and it gets within 3 and 5 years of age. And so we're going to shoot that she's on the 5-year range because then that made her an adult, when like if they did the 3-year range, she would still be a child. So I'm just like, y'all are picking what you want to hear.
No, they were just picking and choosing what they wanted to hear, but it doesn't matter. They jumped her to like
too much.
Ridiculous amount. So yes, Natalia does speak out in the second documentary.
I was just thinking of that time when they were like, how old are you? She's like, I don't even know how old I am. Everybody tell me something different. And she says like exactly like that. I'm like, girl, preach.
So at this point now, she's, I believe, by her original biological age, around 19 when they're interviewing her, somewhere in that vicinity. She's been living with Anton and Cynthia Manns. That's the devout couple who, brought her in. And officially, at some point, they adopted her, although I don't know if she was already 18 at the time. I don't know if it's more of a legal or more of a sort of just we're a family type thing.
Yeah, I don't know if it was legal, but I'm pretty sure if somebody has like disabilities or health needs, you can still do a legal adoption of an adult. It's just a different process. But they could still legally have adopted her, but I don't know if they necessarily made it like paperwork legal.
Right. So that was, she was living with them. And in this, they come and they bring Michael, her former adoptive father, back, and they try and do this interview. Michael's off the rails. So Michael tells us about how he and Christine got divorced, and Christine is torturing him, and she's sending him half-nude pictures, and she's poisoned all her children against him, and he has no relationship with her children. And he's on the floor banging and pulling his hair out and acting I don't even know where. I don't even know.
Well,
He cries.
I'm thinking of the third season when they have that interview that they have to keep stopping because Michael's
I
having
think-
this breakdown.
I know. I think that's in the second. So they try and sit him down with Natalia to have this heart to heart, and
he keeps cursing, and then the adoptive dad tells him not to curse. And
right, the new adoptive dad, who's the pastor, which I think that was a little for show. That was a little bit like, let's cause some drama. Let's stir it up a little bit.
But also,
she's an adult, like she's heard curses before.
She said curses. She was cursing in the season before.
Right.
And like, I get it. If like now she's newly Christian and she's trying to reform, she's trying to manage herself differently, that's fine. But like, they made it out to be way more scandalous than it was. And he wasn't like saying like, fuck you. He was like throwing out curses like in the midst of conversation.
It was a little extra. It's kind of like when they like whisper something in the ear of one of the housewives, like, go do drama, make drama.
It's kind of like when for the documentary, they made Natalia walk up the 5 stairs when we're like, we get it. She can't do stairs. Why do we have to watch this woman suffer walking up a set of stairs?
Yes.
Yeah.
So, her side of the story is that I don't have a whole lot of memory. My life was really effed up, basically. Mm-hmm. I don't know a lot of my early life, but I know I'm safe and happy with the Mans. I have siblings, which are their children. I feel part of a family, and I'm trying to just move on with my life at this point. She does, concur with what Michael's story, that she was abused, I guess, as a child. So the dramatization actually makes an allusion to sexual abuse by Christine to her.
And no, the documentary talks about it in detail.
I don't think
in the third season.
Did I watch the whole third?
Because she's dating the other person with some sort of and he is in a wheelchair, and at one point he's dating her, and he's a character because he talks about how he gets all these women.
Oh, that guy.
Yes, but he said
forgot about how Christine tried to pimp her out.
And that's what I was going to say. Christine proposed to this disabled adult gentleman to have sex with Natalia, and he was like, she's a kid. Like, no, this is gross.
Right. Yes. No, they did talk about that. So I forgot. There's so much to unpack here. It's like you can't even cover it all.
You can't make this stuff up. That's
no, yeah, I forgot. Christine, tried to pimp her out to another. He was like a singer. He was something.
He was many things
to
many people.
His house was quite interesting in its status of, I'm having a documentary crew come over and there's just crap everywhere.
But you know what? He told it how it was.
He did. Like, he was real.
She was true. This hot woman. She wanted to date me. I'm not going to say no. I can get any woman I want. And then no, she was messed up. I was like, okay.
So, but in the dramatization, they made it seem like Christine made her insert a tampon when she was not menstruating, and that she forcefully did it.
I feel like there was conversation about that, but it was kind of just like, what are all the bad things that happened? And then that was like one of the list of things mentioned, and they didn't go into it.
Yeah, so there's so much, and it's he said, she said, he said, who said, like, who knows? But in all of this, there's a disabled young woman, who's in the center of us. We have to think that she is a human. She is not a character, right? Yeah. She's a real person.
And there's a lot of characters in the show, but they are all human they are all human beings.
So essentially, the courts do take Christine and Michael. Christine gets off, which is quite interesting.
It's interesting, but if Michael is telling the truth about Christine's behavior, it makes perfect sense.
Yeah.
Because he basically is saying, like, she did all this stuff and then she framed me for it. And like, when you see him and how over the top he is, of course people are going to be like, this dude's crazy. Of course he did this stuff. And then she kind of exited the situation, literally exited the country, but exited the situation.
Right. So yeah, they're divorced. They're very separated. She still keeps him on a leash, basically from afar.
Which sounds like he enjoys a little.
I think so too. But he's remarried. But yeah, her charges were dismissed. He actually was brought to court. He had this huge legal team, this whole thing, and he was eventually acquitted. I agree with him being acquitted. I do not agree that Christine wasn't even brought to trial.
The issue that I took with Michael, taking aside the drama, taking aside everything else, from very early on, he was aware that Natalia was being abused and he didn't protect her and he didn't report it. That is my issue with Michael.
I agree. He is an adult. He is the other parent in the household. Maybe according to this, he's also a victim of her, but you're still an adult and you're a parent.
Well, I hate to say it. If it was one of his boys, I'm sure he would have reported it.
Right. No, I absolutely agree that he is part of this, but she should have been brought to trial.
I 100%
She wasn't
agree.
even brought. Why? Like he was brought, but she wasn't. That makes
They
no
said
sense
they didn't
to
have
me.
enough evidence, and I was
How'd
like,
they have enough for him?
because he reported that he did stuff.
Well,
he
I guess
told on
so.
himself.
Yeah, I guess so. And then, of course, in the end, Natalia ends up leaving the man's too. Came as a shock after the second one where everything looked so beautiful, happy, hunky-dory.
I was not shocked. No, because at the end of the second one, after the credits, they rolled that phone call.
Oh, yeah.
When the mom was like, she need to get her shit
out.
out of here, like that we can't handle this anymore.
Right. So I guess they framed it as she did something to one of their kids, right?
Allegedly.
And
Because then at one point that particular child says, no, she never did anything to me.
But then Natalia is framing it as they're stealing my money, which is probably also happening.
Yeah, because that's the other thing that nobody has talked about is how much money has Natalia made over all this publicity, and where's that money going, and who's making sure that that's not being taken from her. She's not frivolously spending it. Like, if she is still a child, like she's claiming she is, someone should be a conservator of her money.
Well, now she's she's not an adult. She was born in 2003.
Well, yeah, at this point, but I mean, She was making money from that first documentary.
Right. Well, I don't know. Like I wanted to know if that was just Michael and then they brought her in later and she was making money. I don't know.
I would not be surprised if TLC or whoever signed a 3 documentary contract and were paying people out.
Right. And so the whole way, basically both the documentary as well as the dramatization frame it. What was Christine's reasoning? And they framed it as she wanted this perfect life and she wanted to show the public, I'm writing a book. I did all this for my son. And I have another disabled child. Now
I can do it
how
for someone
good
else.
I am. And then when it was harder than she thought, she tried to turn it into, well, no, she's the bad person. And not me. Whatever it is, it all blew up because I don't think anything really came of her book. I did not look up her book, but I'm pretty sure not much happened sales-wise because everything blew up.
Yeah.
In the end, my personal watching all of it mixed with my background in medicine, and I'm sure you have your background in psychology opinions. I believe, yes, she was a child. Maybe her years were off by a little because that's not uncommon in international adoptions. A year, 2 years, not 13 years. I do believe that she probably did have behavioral issues. She held it together on the interviews. She showed nothing. But the next family now had a problem with her. You kind of say to somebody, if you keep getting divorced or you keep breaking up with someone, maybe it's you, not them. And that's where I came to, there have to be behaviors.
But this was all for a documentary. So the more problems they had, the more documentaries, the more money they're bringing in.
Right. True. But, I do believe, and we'll get briefly into that she has some psychiatric issues related to her trauma from childhood, being an international adoptee, having whatever abuse happened. And I'm sure she did. I'm sure there were some difficult behaviors, whatever the extent of those were. But I do believe she was a child, and I do believe she was abused. And I do believe that it is the chronologic age with the dental records and the bone records makes sense. And even if she had pubic hair, and even if she had her period, that still could be explained by either she's 1 or 2 years difference because her thing was wrong. You can still menstruate at 9 or 10. That can happen. Or she had something called precocious puberty, which we'll touch on.
So I'm just going to give you my opinion because it's food for thought.
Yeah.
I'm not going to weigh in on her age because it doesn't matter.
True.
My thing is why are we assuming that a socially savvy child who has had to fight their way through the world can't manipulate someone?
Mm-hmm.
Like everybody's like, oh, well, she can't because she's a child. She can. And I don't think she was necessarily trying to poison people and things like that. But I could definitely see her. I feel like she was manipulating the mans.
Oh, yeah.
And there's just a lot of stuff about her that doesn't add up that, for me, points to more of these behavioral things that stem from trauma, that stem from not having a supportive family. And nobody was talking about that. They were all like, well, either she's a kid or she's an adult. And I was like, what if she's just a really fucked up kid?
Right.
Who is now doing all these things that people don't understand. And then they're blaming on her being adult, where no, kids can do really negative, inappropriate things. That doesn't mean that they're an adult. It means that we need to give them the space to fix that. And no one at any point tried to do that. Even the inpatient hospital wasn't trying to help her through this stuff.
No, I don't see that she ever got true psychiatric help.
And the thing I alluded to before, which I think is connected to this, because if you've watched the documentary, it is like a smack in the face. Her voice, her mannerisms, her accents change with every person she's around. And that's not manipulation. That's trying to adapt to an environment because you don't know what to expect.
I could see that.
Because when she was with the Mans, her accent changed totally. Her behavior changed totally.
Mm-hmm.
Then when she was with Christine and Michael, I'm not going to get into it because I'm not trying to focus on that. But Christine and Michael were definitely from an upper class, middle upper class, and the Mans are not. And so she was changing her voice, her behavior, her inflection to fit in with Michael and Christine, and then to fit in with the Mans. And maybe she doesn't know who she is or where she fits. That's up to her to decide.
Right. Yeah.
But some of those things, people are like, oh, see, she's an adult. No.
I think I agree. It's an adaptive behavior.
Yeah. It's not
her trying.
It's not a positive adaptive behavior, but it's an adaptive behavior.
Yeah. Yeah. No, I agree. So let's just briefly touch on like skeletal dysplasias. So that is a group of disorders. There's many
that
of them.
website made me sad. If you do any clips, I have a lot of sad faces while you were talking because I was looking at all those babies. And
yeah.
They look so little and so scared.
So it's a group of inheritable disorders. There's varying different ways these are inherited. The most common skeletal dysplasia that is a type of dwarfism called achondroplasia. If someone is to conjure up an image of what we would say is a person with dwarfism, and we wouldn't call them a dwarf, we would call them a little person, just person-centric and in identifying this is a disease process and this is a person. But anyway.
I haven't watched it, but there's a new show on Netflix called You Can't Ask Me That. And there's one episode all with little people asking about what they prefer to be called. And apparently some people don't mind the term dwarf, but other people do.
Right. I would say the medical, you still call it dwarfism just medically to try and group these disorders together. You can't say little peopleism, but is a person.
Little peopleism.
Right. So as a person, as a little person, but yeah. But anyway, so achondroplasia is, if you were to conjure in your mind, what most people think of as a person with dwarfism is a person with achondroplasia. So that's usually more of the, now I'm not going to come up with the word that I'm thinking of.
You didn't even give me any hints to help you with it.
Okay. Non-proportional. Sorry. There's proportional type dwarfism and non-proportional. So where their head may be more average size, but their limbs are going to be shorter and their trunk even may be closer to average size, they may have distinct facial features. So that is achondroplasia, and that is the one we understand the most about as far as the way it is inherited, the characteristics, the things that go through it, and it's the most common. But there are quite a few others, and the one that Natalia has is pretty rare. So, all of the skeletal dysplasias are going to have abnormalities of their long bones, their spine, sometimes their head, short stature is typically what we're seeing. And often some of these can be diagnosed in utero, some after birth. When you do a femur measurement during usually the 20-week ultrasound, often there'll be a clue there. So some common ones, like we said, achondroplasia. There's another one called osteogenesis imperfecta. That is, did you ever watch the TV show The Middle with the mother from Everybody Loves Raymond? And the tall
with Frankie
guy.
Muniz?
No, not The Middle. Yeah, The Middle.
Yeah, Frankie Muniz.
Not Malcolm in the Middle. The Middle. Patricia. Anyway, there's a young boy on that, and that's what he has. The actor. This other one's called thanatotrophic dysplasia, campomelic dysplasia, and hypochondroplasia are some of the more common ones. They really started in the 50s to 70s, starting to sort of identify and classify these better. And then really it took till the 80s, the 1980s, to really get a good grip on these. In the 90s, we really got the genetics, where we had a lot more information on how genetic code works. And so in 97, they came up with a new classification and nomenclature to help distinguish these. And they revised that again in 2015. And they have 436 named genetic skeletal diseases. Mm. So it's interesting. And they're in 42 different groups based on the way they're inherited. But often these children will need specialized care, not just a pediatric orthopedic, but usually a center. There are a few centers in the U.S., which is difficult for a family, typically traveling many states to go see a specialist in this. So it's not something that is very easy for somebody who is born into a family and then they need that specialized care. There is definitely a lot of ongoing research, but right now it's mostly supportive care, getting them what they need to be able to do their ADLs, their activities of daily living. So whether those are braces, whether those are crutches, whether those adapted things in their home, changing the layout of their home in order to accommodate them so that they can function function on their own. And the specific one, like we said, that Natalia had, the spondyloepiphyseal dysplasia congenita, is another one of these is type 2 collagen defect, connective tissues, and it is primarily autosomal dominant. So that's interesting because we know her birth mother was average size, and there's no mention that her birth father was not. So I'm not sure. But typically their height range is between 35 and 49 inches, short trunk and extremities with a small mouth. They often have scoliosis, back pain, hip issues, bowed knees. Their feet are often very deformed. They're turned down and under, and then neck problems due to underdeveloped vertebrae, and they can have respiratory issues as infants, as well as some eye issues throughout their life. And it's typically a comprehensive sort of evaluation, and then eventually genetics, x-rays, and MRI scans to kind of come to the conclusion that they have this. So we already touched on bone age. We touched a little bit on dental age. Let's touch really quickly on precocious puberty, which is early onset of puberty and secondary sexual characteristics in children. Typically, this is due to something going on in the hypothalamus and pituitary, or hormonal changes brought on by that. The definition would be secondary sexual characteristics before age 8 in girls and before age 9 in boys. So that's still pretty young.
Mm-hmm.
We do see children developing at different rates. So it wouldn't be unusual if there are plenty of people who maybe start around 8, and that wouldn't be precocious, start around 8 with puberty and then are menstruating at 9. So it could be something like that, but typically that is somewhere where if we had a suspicion that a child had underarm hair, pubic hair, breast development before a certain age, they would go to an endocrinologist, they would have some laboratory tests, they would have that bone age done, and then they would decide whether they want to give them medications to suppress puberty, because if you do hit puberty earlier, it is going to slow your linear growth, because typically you don't grow in height much after puberty. Usually I think it's a year in girls, or a year and a half in girls. I don't know in boys offhand, but you typically don't grow as much. So if you delay the puberty, they get more linear height, and then you allow them to go through puberty. So, that's again something that would be seen by a specialist. So even if she had that, any pediatrician could refer her to an endocrinologist for a workup. That was never even mentioned once in the documentary as a possibility, which is very strange. And then the big thing, which we've kind of talked about throughout, sprinkled, but reactive attachment disorder, which is very common in adoptees, and international adoptees, very, very common.
Yes.
It's a rare, serious condition where a young child or infant fails to establish the typical healthy emotional bond with the primary caregiver. So if she's in a orphanage and then bounced around to family, she doesn't really have that bonding. And often this is due to severe neglect in their early life or inconsistent caregiving. And they can have all these different kind of withdrawal, fear, sadness, irritability. They can appear listless. They might not smile. They might not really respond well to the typical comfort things and physical touch. And they may have difficulty with social interaction, and really even not reach out when you go to pick them up. If you'll see that in a typical infant, you put your arms out, they put their arms out type of a thing. No interest in playing things like peekaboo. And then later on, of course, behavior problems because of the lack of this development.
And it's funny you say that, because luckily it doesn't happen very often, but every once in a while I'll get a referral for an autism evaluation. And then when I start looking into this history and seeing frequent adoptions or moving around, coming from another country, having some of those early things, it's not autism. It presents differently. It is a very different thing, where if people don't know much about autism or know much about reactive attachment disorder, they may be mistaking one for the other, where there is very, very different beginnings of those types of development that are abnormal development.
Yeah, I mean, I remember specifically when I was doing the inpatient psych and the pediatric, there would once in a while be a very young child. So usually most of these children are older. When you get a 5-year-old and they're having all these behaviors, and you hear they're in and out of this foster house, this system, this, their parents are in and out of their lives. And I'm like, this child just needs consistency, something they can trust, something that they can believe is going to be there tomorrow.
Well, and part of that, why those children, it's so difficult, is and you're probably going to get into this, is that once that kind of reactive attachment is displayed, it's extremely hard for those kids, even when they are in those safe, supportive environments, to connect with their caregivers. And so then a lot of times those caregivers, they're like, I can't connect with this child. They don't want to be with me. Okay, send them back.
Right.
So then it's just perpetuating that same cycle
That
over and
same
over again.
system.
There's a movie about, it's from like the 80s, but it's about a child with reactive attachment disorder and how they kind of break through that difficulty. It's a really good movie. I don't remember the name of it.
All right.
It was like a made-for-TV movie, but it was good.
That was everything in the 80s.
Yes.
So, like we said, living in institutional settings can make this more common. Frequent changes in foster care caregivers or neglect or abuse, traumatic experiences, and even prolonged hospitalizations. And if it goes untreated, they can have delayed emotional development, behavioral problems, difficulty forming relationships, and then, of course, increased risks of other mental health disorders as they get older. So there were a lot of things to touch on this. I think we touched on a lot of little things. This isn't one of those where we do one big diagnosis, but it was more of a back and forth conversation on the complexities of something along these lines, where physical disability, a early childhood trauma, later abuse, it's sad because in the end, she's a person. Even if she did all the things they said. She was a person who was traumatized and did bad things or didn't do bad things, but people did really bad things to her. So
one, like I was saying before, is like, regardless of all of these things, not a single person was trying to do an intervention to help, regardless of where these things came from.
Yeah. So not as fun as Annie as far as Hard Knock Life goes. And by the way, did I tell you that's my child's competition dance song?
You told me it might be. So
yes. So I get to hear
you had
that.
showed me video.
Oh, he did show you. I forgot about that. He did show you. Yeah. So I get to hear that song quite a bit, but I do like it. Yeah. And P.S. Annie, the original one, was filmed partially at Monmouth University. That was the big mansion. Yes. Yeah, which is local to us in Jersey. And then the newer one with Jamie Foxx, a lot of that was in New York City.
Yep.
That took part in. But
which that one was pretty decent. If you didn't watch it,
I liked
it wasn't terrible.
Well, technically that's the version of the song that my daughter's routine is to, is that version of it. So I'm very used to that version currently. But it was pretty well done. And I think there was another one, but there's too many. I can't watch all of them.
Yeah.
So
the spoiler alert, she gets adopted.
If you don't know Annie by now, I mean,
spoiler alert, she gets adopted by a really rich dude.
Seriously, can a really rich dude adopt me?
Well, at this point, there is no Daddy Warbucks because there are no Warbucks.
Yes. Yeah. It was interesting the way. All right. So we got don't murder anyone because you have a neurologic disorder.
I mean, just maybe don't murder anyone, period.
Right. But do be the cool doctor who tries to figure out the mystery. Do not pass off a child as an adult and make them live on their own.
And see, I was going to say, do not adopt a child that you cannot take care of.
True. But I don't know the positive in her story. I can't really find it.
The positive in her story is that Natalia has found her own voice.
True. And she has made connections within the community of other people with skeletal dysplasias. So I feel like that she now has found some of her own people, we'll say, to help support her. So
and one thing I will say is that, like I said, it didn't sound like she had very consistent schooling, but she sounds like a pretty intelligent person.
She does. I think she is naturally intelligent because even in the videos they had of her, she was little. Speak very eloquently, and I think that's part of why they felt she was so much older. But some kids,
I would love to know what her IQ is. I'm sure it's very high.
Interesting.
Or at least her verbal IQ would be very high.
Right, her verbal. We don't know anything else. That was pretty interesting. Okay, I did have one thing I remembered that I wanted to say. Oh yeah, about our stats and all our fun new listeners. So I think some of the states were mixing it up. We got some new fans.
Nice.
So let me pull up my stats
welcome
real
everyone.
Quick. So we had talked about how country-wise Malaysia was coming up on the U.S. and, just one day they're going to pass us as far as listeners. But in the U.S., Illinois came out of nowhere.
Nice.
They weren't even on the top few.
Okay.
Illinois and Virginia.
Yeah.
They're up there. They passed Florida.
Come through.
So, yeah. I mean, Florida, North Carolina, Delaware, Pennsylvania. We got some Alabama, Missouri. I don't know anyone in Missouri, so now I do. Hi.
Yeah. Now we've got friends everywhere. We love you
Ohio,
guys. Thank you for listening.
Yeah, Michigan, New York, South Carolina, Tennessee, and Massachusetts. So yeah, we've got some friends out there. Friends, tell your friends.
And friends of friends, tell your friends.
Yes.
Wait, what's the, have we extended the contest?
I don't know, have we? I didn't think about it. I didn't
you were managing all that.
I know. I didn't do anything else because it just didn't happen. I think we may revisit the issue. I have to see, put it back out there. I feel like our social media people and our actual listeners might be two different people, like different people.
That's
like
fair.
Our family and friends follow us on social media and our listeners are actually like sort of homegrown. So I'm not sure if there's a connection there.
That's fair. Well, listeners, follow us on all of our socials. We are on Instagram, Facebook, TikTok, Pinterest, YouTube. You can send us emails to medicalmediummixer@gmail.com. I would love to hear from you guys because I man the email box. Just so y'all know, I tried to post post on TikTok, and TikTok kept saying that it was a violation of their code. So there's one cocktail that didn't make it to TikTok.
18.
I don't know why, but it's on all the other socials with no problem. So
it is. I don't know why. Cocktail 18. So maybe Le Fatigue. And what was yours called?
Deep Sleep.
Maybe. I don't know.
Yeah, there were no inappropriate words.
Inappropriate?
There were no inappropriate words.
Anyway, I don't know, but we're out there. Shoot Nicole an email so she can be happy. And thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
Cheers.
My glass is empty.